Create a 3 minutes video for YouTube about understanding eating disorders, problems, symptoms, and recovery. Eating is essential for life, health, and enjoyment. But for millions of people worldwide, food becomes a source of fear, guilt, and emotional pain. Eating disorders are serious mental health conditions that affect both physical and emotional well-being. They are not about vanity, attention, or lack of willpower. Today, we'll explore what eating disorders are, why they develop common signs and symptoms, how recovery and healing are possible. This video is created to educate, reduce stigma, and encourage compassion. Part 1. What are eating disorders? 2 of 5. Eating disorders are psychological conditions marked by disturbed eating behaviors and unhealthy thoughts about food, weight, and body image. They can affect children and adults. All genders, all cultures and backgrounds. Eating disorders often involve extreme control over food, fear of weight gain, emotional dependence on eating habits, distorted body image. They are among the most serious mental health conditions because they directly affect physical health. Common warning signs: obsessive thoughts about food, skipping meals, extreme dieting, binge eating, purging behaviors, excessive exercise, social withdrawal, mood changes. Early recognition saves lives. Part 2. Anorexia nervosa, 5 now or 9. What is anorexia nervosa? Anorexia nervosa is characterized by severe restriction of food, intense fear of gaining weight, distorted body image. Even when underweight, individuals may see themselves as overweight. Symptoms: extreme weight loss, avoiding meals, obsessive calorie counting, fatigue and weakness, hair thinning, cold sensitivity, depression and anxiety, problems and risks, heart complications, bone loss, hormonal imbalance, organ failure, increased suicide risk. Anorexia has one of the highest mortality rates among mental disorders. Treatment and recovery, medical monitoring, nutritional rehabilitation, psychotherapy, family support. Long-term follow-up recovery takes time, but it is possible. Part 3. Bulimia nervosa, 9 out of 13. What is bulimia nervosa? Bulimia involves cycles of binge eating, followed by purging, vomiting, laxatives, fasting, excessive exercise. People with bulimia often maintain normal weight, making it harder to detect. Symptoms: secretive eating, frequent bathroom use after meals, sore throat, dental erosion, swollen glands, shame and guilt, problems and risks, electrolyte imbalance, heart rhythm problems, digestive damage, tooth decay, mental health issues, treatment, cognitive behavioral therapy, nutritional counseling, medical care, medication when needed. Early treatment improves outcomes. Part 4. Binge eating disorder, 13-17. So, what is binge eating disorder? Binge eating disorder involves repeated episodes of eating large amounts, feeling out of control, no regular purging afterward. It is the most common eating disorder. Symptoms: eating very fast, eating when not hungry, eating alone due to embarrassment, feeling guilty afterward, emotional distress, problems and risks, obesity-related illness, diabetes, high blood pressure, depression, low self-esteem, treatment, therapy for emotional regulation, mindful eating, medical support. Lifestyle guidance recovery focuses on healing the relationship with food. Part 5. ARFID, 17-21. What is ARFID? Avoidant restrictive food. Intake disorder is characterized by extremely limited food intake, avoidance based on texture, taste, smell, or fear. Not related to body image, ARFID often begins in childhood but can persist into adulthood. Symptoms: very restricted food choices, nutritional deficiencies, weight loss or poor growth, anxiety around eating, avoidance of social meals, problems and risks, malnutrition, delayed development, social isolation, anxiety disorders, treatment, behavioral therapy, nutritional rehabilitation, gradual food exposure, family-based support. Part 6. Why eating disorders develop. 21-23 sex. Eating disorders usually develop from multiple factors: biological genetics, brain chemistry, psychological perfectionism, trauma, low self-esteem, anxiety, social cultural beauty standards, weight stigma, bullying, family dynamics. No one chooses to have an eating disorder. Part 7. Recovery and hope. 23-25. Key principles of recovery. Early help matters. Compassion is essential. Relapse does not mean failure. Support systems are critical. Helpful supports. Mental health professionals, doctors, and dietitians. Family and peer support. Support groups. Recovery is not about being perfect with food. It is about rebuilding trust with your body and mind. Closing message. If you or someone you love is struggling with an eating disorder, help is available. You deserve care. You deserve healing. You deserve a life beyond food and fear. Thank you for supporting mental health education. Use a male voice with a Midwestern accent for the narrator.